Welcome everybody. Today we're going to talk about oral health and the gut link. So we're going to get mouthy. Sorry, I have a lot of fun with my class names. But I wanted to make sure first to do a little disclosure, which I'm supposed to do before every training and I often forget, that I am not a doctor. In this case, I'm not a dentist or an oral health specialist. This is not meant to be advice. This is meant to be information to help us live above the wellness line. So we're going to talk about wellness. We're not going to talk about sickness or illness. We're going to talk about how to be and stay healthy in the hopes that we can continue to live above that line. If we dip down below that line, we want to work to get back up to that wellness and health line. So that's where we're going to talk. I'm going to try and avoid talking about anything that you could be diagnosed with, any kind of treatments, anything like that. We really want to focus on where we want to be and where we want to live, and that is in wellness and health. So let's talk about that. Hang on, apparently there's somebody in the waiting room. So as I get going, if you have questions, type them in the chat box. If you are watching the replay video and you have questions, feel free to reach out to me and I will be happy to help answer any questions that I can. So why does our mouth and oral health matter? If we look historically across many, many cultures, there are some cultures which have throughout history valued oral health above all else or above much else. And it can be really, really fascinating to look across cultures at what they thought was important as far as oral health and why it was important. When we look across time, we can see some cultures have put much more focus on oral health than others. And we see in the United States, scientists catching up to some of those other cultures. So for example, there has often been believed a connection between oral health and cardiovascular heart health. There's been a lot of studies in the last decade and a half of the link possibly between gingivitis and cardiac health, heart health. It's something that has been talked about in many cultures over time, but in the United States, our scientists are starting to catch up to that and recognize that there is a link. So in a lot of dental schools now, dentists and oral hygienists are taught about watching for signs and symptoms that are happening in the mouth and then asking questions about the rest of the body systems of their patients and clients so that they can go back to their primary health care and start exploring possible issues that may be showing up. A lot of times they can see early signs of something happening somewhere in the body by what's showing up in their mouth. So it's been fascinating to watch, to know some of the history of oral health and the beliefs around oral health in other cultures, and then watch how science is catching up and shifting and pulling that in. In Eastern medicine, there's a lot of Eastern traditions where they put so much focus on oral health that they can actually find a link between each individual tooth and an organ of the body. So they may send somebody, they may have sent somebody, you know, they knew they couldn't open up somebody's body and look in and see what was happening in the kidneys or the spleen or the liver, but they could have somebody open their mouth and then they could see, is one of those teeth discolored or turned or having issues of some form, and then they might be able to make that connection to the organ itself. So if you're curious about that, you can go online and look up, check out Uncle Google and look up, there's lots of charts in there about where the teeth connect with different organs in other body systems. I'm not going to go over that, but it is a place that a lot of people are looking more and more. We also have a big tradition in a lot of cultures of using the tongue to diagnose things in the body, health and wellness in the body. A lot of cultures, acupuncturists, herbalists, in Ayurveda, in a lot of different traditions, when they're doing an evaluation of your health and wellness, they'll have you stick out your tongue and then they'll look at it to see what is being represented in your tongue and what might that mean for the rest of your body, for the health and wellness of your body. So using the mouth and everything in the mouth to take a look at and understand what's happening throughout the body is really common throughout history. Now, one of the great things is that we don't actually have to know all of that in order to take really good care of ourselves. We can go down that route, or we can just take really good care of our mouths and allow that to translate through our body and back and forth to help with the balancing out. So your oral health can be an indicator of health in other parts of your bodies and vice versa. Right now, this is really important to know because we're in shelter in place throughout the United States and much of the world. We can't really go out and see our oral health providers. We can't get to the dentist or the orthodontist or any of the oral health specialists. So it's especially important to put more focus on our oral health right now. I know I have a few clients and family members who are having issues with teeth and gums and health, and they're not able to get to a dentist because it's not technically an emergency yet, even though they're in a lot of pain and they're having a hard time and they're getting infections and going through all of this. So it's really important to pay attention to and do everything you can to be as healthy as you can right now, so you don't fall into that category of having to scramble and try and figure out how to get some support. We also have to remember that the function of our mouth has a direct relationship with the function of our gut. So we think about what happens when you eat food. When you put food in your mouth and start chewing, what's one of the first thing that happens is we salivate. We create saliva. That has a reaction in our system that there's basically receptors in our mouth to see what kind of food is it that we're eating and what kind of enzymes do we need to break it down. And then those signals travel to our gut, and our gut will start releasing and producing different enzymes depending on what it is that we're eating. This is one of the reasons it's really important to chew your food well, because you're giving your body time to prep the stomach and all the enzymes in the stomach and the hydrochloric acid and everything else that's happening, so that when you swallow and the food goes down, your stomach's already ready for it. It's like, all right, I know this is coming. I've got the perfect soup of chemicals to break this down. We're ready to go. So chewing your food well is important, not just because you want to have it chewed and broken down, but to support the preparation for your gut so that it is ready to digest everything that it's getting. So we have enzymes in our mouth, in our saliva, to start breaking down food. And then we have enzymes in our gut to continue breaking down that food. Enzymes are super important. I talked about enzymes a bit in my supplement class. If you didn't see that, you're welcome to go check it out on YouTube or ask me questions. Young Living has a whole bunch of enzymes to help support your digestive health and wellness. But if you have an inability to salivate, so you don't have salivary glands, or they're clogged or problems, then the enzymes may not get turned on, may not get turned on at all, or may not get turned on early enough, and then you're going to end up with undigested food. Undigested food, or food that stays in the stomach for too long, within about 7 minutes, can begin rotting, can begin fermenting. And rotting and fermenting food in our gut is not good and not something that anybody wants. It can really have a detrimental pull on our health and wellness. So you really want to be able to break down food. I've learned a lot about people who have an inability to salivate because I have a client that was born without salivary glands. I didn't know that was a thing that can happen, but it's pretty amazing the things that she's had to go through throughout her whole life, simply because she doesn't have the ability to salivate. Dry mouth is a huge problem. Our ability to keep our mouth moist naturally helps to cut down bacteria, helps to keep any cuts and abrasions within our mouth healthy and well. If you don't have that ability, it can cause a lot of problems in your digestive health and your overall health and in general. So salivating, being able to have that moist mouth, super, super important. We also have to think about the direction, the other direction, things from our gut showing up in our mouth. Now, of course, first thing I think of when I think of that is vomiting, and it's the last thing I want to think about. But anytime something like that happens, we have that hydrochloric acid, all that stomach acid coming up. That's not the only time we might have something from our gut showing up in the back of our throat or our mouth. Think about what happens when you've got, maybe you've eaten too much, you've got like just discomfort in your belly, and then you start to get those bubbles that come up, right? A lot of people don't feel the bubbles, but they'll feel like heat or intense like hotness here, right? That sensation right there is a good indicator that there's something going on with your gut. Also remember though, the thing that causes that is the bubbles of acid, of stomach acid, that aren't staying in the stomach, aren't staying in the belly, and they're what's coming up. And as they pop, as they come up and pop, that spreads that acid through the back of our throat and the back of our teeth. So you can end up with acid erosion in your teeth, not from sodas, not from all of these other things, but from stomach acid showing up in your mouth from having that, acid coming up. So you really want to take good care of your stomach lining, your digestive system, to make sure you reduce that as much as possible, because you don't want to wear out your teeth, especially those back teeth. It's hard to chew if you don't have those. You want that to be healthy. So your gut health can have a really important and direct impact on your oral health. And then also think about what happens in the back of your tongue if you have that acid coming up. It's not a pretty situation. This can also lead to smelly breath. There's lots of things we can talk about with smelly breath, but having smelly breath can be an indicator that there's something happening in your gut or even further down in your digestive system. Now, smelly breath can come from something happening in your mouth, but it can also come from something happening in your gut. And my dentist taught me years and years and years ago an easy way to tell the difference. It takes another person and probably another person that loves you pretty well. But all you do is you breathe out your nose, and if they smell bad breath, that's likely coming from your belly. If you breathe out your mouth and it smells like bad breath, it could be coming from your mouth or your belly. If you just brushed your teeth and rinsed your teeth and then you didn't eat anything and you wait for a while and breathe, maybe your belly. But if you just take all that out of the equation and breathe out your nose and you get a bad breath smell, it's likely coming from your belly. Now, I don't suggest doing that right now with the average person or anybody who's not been in quarantine with you for more than 2 weeks, and somebody that loves you very, very, very well. But I found it really interesting to know the difference. He did say for some people, you can put your hand over your mouth, close your mouth, breathe out your nose, and then breathe in. And if you can smell your own breath there, not breathing through your mouth, then likely there's a stomach issue. It is a little bit harder to do because there's that time difference between when you breathe out and breathe in. So that smell may have gone away. And because we breathe our own breath all day long, oftentimes we're desensitized to the smell of it. So it can be hard to smell your own breath if it's coming out your nose. But I found that to be interesting and useful when I was working with him. Another thing to talk about with oral health is let's talk about what's lining the inside of our mouth. Okay, so what do we call everything lining the inside of our mouth? What kind of tissue is that? Skin. Yeah, it's skin. So if I think about all of my skin and I track my skin and I come up to my mouth, it doesn't end at my lips. It's not like this is where my skin ends. It actually lines the insides of my lips. It lines my cheeks. And I can actually continue down my throat, down my esophagus, into my stomach, small intestines, large intestine. We're basically like a donut of skin. Everything on the outside of the donut is the skin that we can see. And inside that donut, where that donut hole is, would be everything from our mouth to our anus. All of that is still lined with skin. Super, super fascinating when I think about what we know about the skin. Skin is the largest organ of the body. Most of us know that by now. But if we put any personal care product on our skin, right? If I put a lotion or something, any personal care product on my skin, it takes 26 seconds for the molecules of that to enter my bloodstream. And within 2 to 3 minutes, it's throughout my entire body. All right, so let's think about what that means for your mouth. If I put anything in my mouth, that skin has a lot of the same function. So anything that I put in my mouth and swallow quickly has about a 5% absorbability and bioavailability into the bloodstream, because it has to get digested, and then it generally passes through the skin, the lining of the small intestine and the large intestine as it's digested. If you hold something in your mouth for 30 seconds, it has at least a 95% absorbability and bioavailability in the bloodstream. So we go from swallowing and having 5% to holding something in our mouth and having a 95%. Of course, this depends on the size of the molecules and what we have in our mouth. That all does have an impact. But let's think about this for a moment, okay? If you take toothpaste, put it on a toothbrush and start brushing, how long are you brushing your teeth according to the ADA, the American Dental Association? How long are you supposed to brush your teeth? Yep, 2 minutes. How many times a day? At least 2 times a day, right? They'd like us to do it every time we eat, but at least 2 times a day. So if I'm brushing my teeth for 2 minutes, twice a day, that 30 seconds is way exceeded, 4 times that. So all of that toothpaste that is in my mouth, I'm scrubbing around for far more than 30 seconds. So it's getting into my bloodstream, right? That 95% bioavailability into the bloodstream, absorbability, super important. Now take a look at the back of a conventional toothpaste bottle, and what does it say? Do not swallow. What happens if you swallow? Who do you contact? Poison control. Yeah, I'm reading everybody's lips here as you're talking. You contact poison control if swallowed. And what do we do if kids under 2 years old? Don't use it or use a tiny bit, and monitor them and make sure they spit it out. Great information, but when we look at the absorbability and bioavailability percentages, that doesn't make sense. And then think about what's happening when you're brushing your teeth, right? We're using toothbrush, whether it's electric or standard conventional. We're scrubbing. And when we scrub things, we can often cause abrasions, right? Anybody have bleeding gums? And even if you don't have bleeding gums, you might be scrubbing a little bit too hard. Scrubbing hard and too hard is actually one of the #1 issues that dentists complain about when they see their clients. They scrub too hard, or they're using toothpaste that's too abrasive and it scrubs too hard, and it actually is micro-abrading super tiny cuts in the skin and in the mouth. So then that allows even more absorption of those things that we don't want in our system. So you have to be careful and pay attention to what it is that you're putting in your mouth, what you're doing with it, and why you're doing it. You can see a lot of those same things on the back of a mouthwash, right? When we use mouthwash, what are we doing? We're swishing it through our mouth for a long period of time. Usually it says a minute or more. We've exceeded that 30 seconds, and we're potentially absorbing a lot into our bloodstream, right? Not a great thing depending on what's in it. So that's something to pay attention to. That's why we want to make sure we're using really clean, really pure products. It's very important. So let's talk about some of those products and what they might be. In Young Living, there's an entire line for oral health. And then we also have essential oils and supplements that can boost your oral health directly and indirectly. If we think about that gut link, we think about the cardiovascular link, we think about the link of all of the different organs in our body and how that fits with our oral health. If we can take care of anything in our body, we have more ability to take care of all the other pieces of our body. So Young Living has created an entire line of toothpastes. And all of these toothpastes are free of those harmful chemicals that we really don't want to get into our bloodstream and into our system. They have actually worked with many, many countries, and a lot of countries across the globe have different requirements of what is allowable and what has to be avoided. And many countries have stricter regulations than what we see in the United States. So Young Living has been very careful to incorporate all of them from other countries, not all of them, but many of them from other countries, to make sure that they're really getting the cleanest products across the board and finding solutions that would meet the needs that we have for our own health without compromising our health in any other way. So the most recent toothpaste that they came out with is the Thieves Whitening Toothpaste. Previously, we didn't have a whitening toothpaste. We had a whole bunch of other different kinds of toothpaste. But the whitening toothpaste, when they came out with this at convention last year, I think it was last year, the exciting thing about this was that they tested it against a large number of other whitening toothpastes, and it actually performed better. And it performed better for a lot of reasons. One of those reasons is that it uses much smaller molecules for that scrubbing action, and they're round molecules. In a lot of the other toothpastes out there, they use molecules that have a lot of edges to them, sharp edges, because they're scrubbier. But really what that does is it abrades the teeth and the gums and everything else in your mouth. So the silica particles, the particles in here that are meant to be scrubby are round, so that they scrub without abrading, without cutting, without digging in. So it actually polishes the teeth much more, and much more like you would get a polish at the dentist, right? Just polish all of the extra off. There's also a lot of whitening essential oils in here that are used for whitening. Orange essential oil, believe it or not, is a great whitener, especially in teeth. So they use orange essential oil in the Thieves Whitening to help whiten teeth. The Thieves Whitening toothpaste has a bunch of ingredients that are really helpful, and it avoids ingredients that are not. It's formulated without any GMOs. There's no gluten-containing ingredients in there. There's no fluoride. It's cruelty-free. It really does provide a long-lasting, smooth, fresh feel. Like when I started using this, it made me think of having gone to the dentist and how I felt just after I had my teeth cleaned. Now I'm used to that, and I'm getting a little bit spoiled, always having that really fresh feeling in my mouth. It fights plaque and supports healthy gums. It helps to reduce and prevent tartar buildup. It's free from harmful peroxides. It gently removes surface stains and cleans teeth, and it whitens and brightens your teeth. There's a lot of things that it doesn't have in it, which is, really helpful and good. And we want to always pay attention to both what our products have and what they don't have. So the Thieves Whitening toothpaste is my #1 go-to for toothpaste. It has a like thieves and orange flavor to it, and a little bit of mintiness to it. There are a whole bunch of other toothpastes available from Young Living that are not whitening focused. We have the Kids Sense toothpaste. They also knew when they were creating the Kids Sense toothpaste that a lot of kids don't like the mint flavor. It's too hot, too spicy. So the Kids Sense toothpaste is more citrus flavored. It's a sweeter citrus flavored. So a lot of kids and adults like that one. We have the Dentarome, the Dentarome Ultra, lots of different toothpaste options. And then they also have a few toothpaste options in a smaller size for traveling, right? Smaller size for traveling. And even have the Thieves Whitening toothpaste in little tiny individual packets so that you can share, or if you're going to be gone for a day or two, you can just take one of those packets and use that on your toothbrush. When I started with Young Living, I looked at the price of the toothpastes and I thought, there is no way I'm going to pay that much for toothpaste. So I kept getting conventional toothpaste and I had no problem with it. And then I started learning outside of this about oral health and about what was in toothpaste and how that might affect my well-being. And I started thinking about it. So I racked up my Essential Rewards points, those free points you get for ordering monthly if you're on the Essential Reward program. And when I went to claim them, I decided I was going to get a bottle of toothpaste just to see what it was like. And I wasn't having to pay for it because those are, my free play points. And I got a bottle of toothpaste. And I realized I only needed to use a tiny, tiny bit of toothpaste on my toothbrush, way less than I use the conventional toothpaste, like way less. And then the months go by and I'm still working on that same bottle of toothpaste. And what I realized was with conventional toothpaste, I was having to buy about a tube a month. Single person, brush my teeth twice a day, whatever. I was buying about a tube a month of the old kind I was buying. With Young Living toothpaste, my toothpaste could last me 4 months. And I realized I'm actually saving money by buying this toothpaste. When I did the price comparison, not by ounces, but by how long that tube lasted for my regular use, I was saving money buying the Young Living Thieves toothpaste. With the Thieves Whitening toothpaste, it does have a little bit of that foaming action that we get in conventional toothpaste. The other toothpaste, not so much, but this one does. So I use even less of it than I used on my other Thieves toothpaste from Young Living. So this bottle, it truly lasts me a long time. And as just a hint, when you get to the end of your bottle, there's still a lot of toothpaste in here, and that would drive me crazy. So I take scissors, I cut off this part right here, and then I will, cut it down to wherever the residue of the toothpaste is. I'll dip my toothbrush in there. It's just me, so I'm not, double dipping with somebody else. I'll dip my toothbrush in there, and then I have a chip clip that I put on the top of this, and I can get almost another week worth of teeth cleaning out of the end of the bottle. So just a little tip there. That actually happens with a lot of products from Young Living. Can't quite get everything out of the container, so there's a lot of hints and tricks about how to really get that last little bit. So I totally get that out. When we're talking about whitening your teeth, right? So if you want to focus on whitening your teeth, you can also just take that Orange Vitality essential oil and put that on your toothbrush and brush away. You want extra whitening? Throw some Orange Vitality in there. You can add Orange Vitality in your water, but it depends on if you're adding that for flavoring and drinking that, or if you're actually going to swish it through your mouth. So we're going to talk about mouth rinses in a little bit. Actually, let's talk about that next. So mouthwashes and mouth rinses. We have the Thieves mouthwash. This is formulated as a mouthwash. Swish it around in your mouth. And then the way this is formulated, it is okay to swallow. You don't have to swallow it. It's not necessary to swallow it, but it's not going to be harmful if you swallow. You want to swish it around really good in your mouth, just like you would with any other mouth rinse. A capful is plenty, plenty, plenty. And I know a lot of people who will actually take this mouth rinse and dilute it a bit. If you're rinsing your mouth out twice a day and you've already got a lot of good oral health, you can use a half a capful and then take the other half with water and rinse that around. The Thieves mouthwash has Thieves flavor in it. If you don't like that, take your orange or whatever other flavor you want more of and add that. That's a great way to do it. Personally, I love the Thieves mouthwash as a throat spray. So I will take my old empty spray bottles or a glass spray bottle, and I will put it straight with Thieves mouthwash. Right now, with everything that's going on out there, it's really important not to have a dry throat. A dry throat has more possibility of catching and holding things that we don't want to hold. And we want to have a moist, wet throat so that as we swallow, any extra things that come into our system can go into our stomach, and our stomach acid will generally take care of it. So I've been using Thieves mouthwash straight in a spray bottle. And then depending on what I have going on, I may add some more essential oils to it. So if I want an extra immune boost in the back of my throat, I'm going to throw a couple drops of Thieves in there. If I've got something going on where it's like, oh, that tingly, like uncomfortable sensation where I want it to be a little more numb, I can use Thieves, or I can use Clove. Clove Vitality Essential Oil is a great one for that numbing sensation in the back of your throat. If I'm wanting something that's more freshens your breath, then maybe I'm going to add peppermint or cardamom, or let's see, what else did I have for freshen the breath? I wrote down these: peppermint, Thieves, nutmeg, cardamom, lavender Vitality Essential Oils are all great for freshening breath. So I can add that to my mouthwash in my spray. You can also just create a spray. So if you take your bottle, this is a 1 ounce bottle, and you add 5 to 6 drops of essential oil and then top it with distilled water, shake it up between each time and spray it, it makes a great mouth spray. So if you're wanting to work on your oral health, let's say that you've maybe neglected your gums a bit and they're a bit raw or puffy or uncomfortable, you might want to make a spray with Thieves essential oil. So I put 6 drops of Thieves in here, fill it with distilled water, and then I'm going to spray my mouth really good before I brush my teeth. That will start that support in my gums, in my oral health, before I start brushing my teeth and get a bit further. If it's uncomfortable, then maybe I'm going to add a couple of drops of clove for that numbing action. I don't want it to be so numb that I don't know what's happening in my mouth. That's not a good thing, right? Those sensations are important if they're showing up. There's a whole bunch of oral sprays that you can make with essential oils, depending on what it is that you want to do. If you want a fresh breath spray, same thing, 5 to 6 drops of whatever it is you're putting with distilled water. Now, right now, it's been kind of hard to get distilled water for me, so I'm just using filtered water. It's okay. It's not the best, it's not the worst, it's fine. But that's been really helpful. It's also important to floss your teeth. I've never been a big flosser. I've never been a fan of it, but I know how important it is to get between my teeth and for my gum health, which then translate to everything else. So we have Thieves Dental Floss. Now with the Thieves Dental Floss, I will be totally honest, I thought this was going to be like super cinnamon dental floss and it tastes all cinnamon-y like those cinnamon toothpicks I used to have when I was young. It's not that strong. But the dental floss itself is coated with Thieves essential oil. So as you're flossing your teeth, you're getting that extra support between your teeth and into your gums. The Thieves Dental Floss comes in single packs and in 3 packs. So if you're a regular dental floss user, the Thieves Dental Floss is a nice option and a nice way to go. It has 164 feet or 50 meters in each individual dental floss. So, you know, it can last a while. But that's another way to help support your gums and your oral health in general. Speaking of toothpicks though, if you're a toothpick user, it can be really cool to make flavored toothpicks. And I know I'm totally dating myself, but I'm not worried about that. Back in the 80s and early 90s, we used to have these cinnamon toothpicks. Do you remember those? Yeah. So there are actually a whole bunch of recipes online of how to make your own cinnamon toothpicks. I'll tell you one of those now. All you do is you take 100 plain brown wooden toothpicks. And then you're going to use, and you can cut this recipe in half if 100 is too much. But if you have a family of 4, 100 toothpicks, you know, that's not going to last you that long. You take 15 to 20 drops of Young Living Vitality cinnamon bark. 15 to 20 drops of Young Living Vitality cinnamon bark. And then you're going to use either, not both, but either 2 tablespoons of vodka or 2 tablespoons of pure vanilla extract. You don't want the imitation extract here. You want real vanilla extract, 2 tablespoons. If you are using the vodka, you can put a drop of liquid stevia to sweeten it up a little bit so you don't have that like bitterness to it. And then you're going to take a glass jar. And all you do is you blend together your alcohol or your vanilla extract, whichever you're using, your essential oil and the stevia if you're using the stevia. You're going to sprinkle that on top of the toothpicks in the jar. So put the toothpicks in the jar, sprinkle that on top, seal the jar, shake it around, mix it around really well. And you're going to store it in a dark place for at least 48 hours. You're going to shake the jar several times a day. After 2 days, once the sticks have really soaked up and infused everything that's in there, you can lay them out on a paper towel to dry. Once they're dry, store them in, you know, a glass jar or anything else that you have that is something that you would store them in naturally, and then you can use them and they will have that cinnamon infused flavor to them. So it adds that little boost. You can do that with any of the essential oils that you would use. So if you're a toothpick user, you can make peppermint toothpicks. You can make Thieves toothpicks, cinnamon bark, orange, lemon, whatever vitality version of essential oils you want to use in your toothpicks to have that flavor, but also to get the benefits of whatever it is that you're scraping or doing between your teeth. So that's just a fun way to use some of your essential oils for your oral health as well. So if you have an issue, if you have something going on, especially right now when we can't get to the dentist, unless it's an emergency, you can use, there's a lot of different essential oils that you can use to support that discomfort that you might be having, so it is lessened, so that it can extend the time between now and when you actually have to get to the dentist, because we're all, you know, trying to not get there right now. You can put in one of the oils on a cotton ball and then put the cotton ball in your mouth, or you can put it on a Q-tip and rub it on the specific place in your mouth that you're having that discomfort. Or you can rub it on the outside on your chin and your jaw, depending on where it is. So typical oils used for discomfort, if you've got something going on that's like, oh, I need to, you know, deal with this. Clove, super numbing. Thieves, super numbing. German chamomile, all of these are the Vitality version. Great to use. Helichrysum doesn't come in Vitality, it comes in just the regular oil right now. Helichrysum, wintergreen, and panaway can be used externally on the jaw or the cheek, wherever it is that you're having problems. Even though the pain is on the inside or the discomfort's on the inside, you can put it on the outside. It'll be helichrysum or panaway or wintergreen can help support that sensation being less, even if you're putting it on the outside, wherever it is that you're having problems. Being aware that you don't want to get it into your eye and all of that, you know, safety stuff. I did do an essential oil safety video, so if you want that information, check out my YouTube channel and you can watch that video of how to take care of that. If you have really having a lot of nerve sensations, that like zing, that discomfortable zing, and you can't get to a oral health practitioner right now, another option would be to take 1 drop of tea tree and a small amount of water. Mix those together and then rinse and hold that in your mouth for 1 to 2 minutes. This can help to calm that nerve and calm that sensation to extend the time that you have before you need to get to your dentist or your oral health specialist. There's a whole bunch of things that you can do for your oral health. There's a lot of suggestions for what you can do. If you have one of the essential oil desk references that's often used with Young Living, check out the information under gums, under oral health, under teeth, under mouth, under all of those categories and see what's in there. There's a lot of really great information. We also have Thieves Mints. The Thieves Mints can be used to help freshen your breath, and along with the Thieves Lozenges and the Thieves cough drops, they can be used right now with everything that's going on to help you keep a moist mouth and a moist throat. A moist mouth and a moist throat are very important if you're going out in public, because if we're interacting with people that have things going on that we don't want to absorb and that does get into our nose or mouth, we want to have that moistness to be able to send that straight to our stomach. So having and using your Thieves Mints, your Thieves Lozenges, your Thieves cough drops, all of these are really good options to help keep that moist and moving. It can also be useful right now to start using more of your alkaline. Alkaline. If you are breathing out your nose and smelling it coming from your gut, this might be an option to help calm things down so that that doesn't happen. Alkaline can help support your optimal pH in your stomach to prevent some of that stomach upset and to keep some of those bubbles that come up from coming up. So alkaline can be super helpful right now if you're having that situation as well. We also have to remember that our toothbrushes, while very important, very useful and necessary, we need to clean them, sterilize them, disinfect them, and or replace them regularly. And I know a lot of people just haven't been doing that or doing that enough. So check out, when's the last time you replaced your toothbrush? Can you get another toothbrush or toothbrush head? If you can't, just not, supply chain issues, then it's important to disinfect and sanitize your toothbrushes. Not just the bristles, but your entire toothbrush. I know a lot of people that will work to disinfect the bristles, but they don't think about what else goes in their mouth. The head of the toothbrush and part of the handle goes into your mouth as you're brushing. So you want to disinfect all of that. Really important to pay attention to. We don't want to add bacteria that's been sitting there for 12 hours back to our mouth. Cleaning and disinfecting your toothbrush, really important. while we're talking about toothbrushes, you can always add essential oil to your toothbrush before you begin brushing, whether it's just to your toothbrush or to your toothpaste that's on your toothbrush. You can do either or both. So if you're having some breath issues that you really want to freshen what's happening in your mouth, throw a drop of peppermint vitality onto your toothbrush before you start brushing, or Thieves Vitality. If you need some extra support of health and wellness in different areas, let's say you've got something going on with your gums, or you've got something going on with, you want to make sure you have a healthy level of inflammation, which you know what a healthy level of inflammation is, right? You might put a drop of Copaiba Vitality on your toothbrush and brush that around in your mouth while you're working through whatever it is you're working through, right? So you can add essential oils directly to your toothbrush. You can add them directly to your toothpaste. You can put them on your gums if it's the Vitality version, on the inside of your mouth, on your gums, on your cheeks. You can put them along your gum line, on your cheeks if you need that extra support. You can put them on a cotton ball or a Q-tip to get like really precise placement of an oil if you need. And then of course you can put them in the sprays. Make your own sprays, whether it's a spray that has mouthwash in it or just water. Super useful, super helpful. Also want to point out that just using your essential oils in your mouth can be really useful. So when I want an extra immune boost, I will take my Thieves Vitality and I'll put a drop of that under my tongue. Why am I putting it under my tongue? I'm using that 95% bioavailability into my bloodstream by putting it underneath my tongue. The pharmaceutical companies have figured out, a lot of them have figured out how important and how useful it can be to have that sublingual application. So like a lot of vitamin B that's liquid is used sublingually underneath the tongue because of how quickly it absorbs into the bloodstream. I use that property when I'm using my CBD oil from Young Living, from Nature's Ultra. I will put the CBD oil on the skin underneath my tongue and let it absorb through there, because I'm getting it more into my bloodstream than if I just swallowed it. And into my bloodstream is where I want that to help support the endocannabinoid system in my body and in my brain. If I want to get additional support, I might also put a drop of essential oil, whatever essential oil it is, on my thumb, and then put my thumb on the roof of my mouth and suck. That, putting it on the roof of your mouth and adding the extra suck, can help to pull some of that oil into the roof of your mouth. There are a lot of healthy ways, or reasons you might want to get oil into the roof of your mouth to support your mouth, your oral health, and everything that happens to land above your mouth. You get to think about what that is. So that can be another way to use essential oils internally without just swallowing them, where it actually gets to get through your bloodstream because of that. Frankincense Vitality, a really good one to do for that as well. Let's see, what other oils did I not talk about? I think I got all of those. One other thing I want to bring up when we're talking about oral health is that a lot of people, when they talk about oral health, only think about their mouth and their tongue, right? And their gums, maybe the back of the mouth, maybe. But your lips are also an important part of your mouth, right? They can help to control what comes in and what doesn't. And if they get chapped or have little abrasions on them, that can cause a lot of issues. So having a good chapstick, especially right now, super helpful and super important. We want to have healthy, moist lips to prevent all of this extra stuff from coming into our systems. Now, there's some really great and terrifyingly gross evidence out there that when we're looking at lipstick specifically, the average woman eats 7 pounds of lipstick in her life. It's not that she's, taking lipstick and then chomping on it, but just based on what's on her lips and then ends up in her mouth and being digested. The average woman, 7 pounds of lipstick in her life. That's a lot of lipstick. And then if we look at what's in conventional lipstick and how those are made, oh, it just gives me the heebie-jeebies. Next week, I'm going to talk about beauty routines, makeup and clean beauty routines. So we'll talk about that more next week. But it's really important to pay attention to what you're putting on your lips, because whatever you put on your lips, some of that ends up in your mouth And much of that ends up in your bloodstream because your lips are skin also. So you get whatever you put on your skin ends up in your bloodstream. So pay attention. The Young Living lipsticks are made very clean. They've banned more than 2,500 products that are banned in Europe, that aren't banned in the United States, but are banned in Europe, to make sure that what we're getting if we're using those products is clean. So that's why I choose Young Living chapsticks and Young Living, or lip balms, I should say, and Young Living lipsticks when I'm going to use that. I don't want any of that extra in my system. All right, so I've covered a lot of things where oral health is concerned. I've covered a lot of suggestions and ways to help extend your ability to not have to go to an oral health specialist right now, since we can't get to one because of the shelter in place. But please, please, please remember, your oral health is so important. And if you can put a little bit of extra focus here, it really does have the potential to help support the health of your entire body and your entire system. Think about those connections. Think about what you're putting in your mouth and then what you're doing with it and what that impact may be. All right? All right. Thank you all for being here. Thank you all for participating. And I'm going to stop this recording.